Hello, I'm Angeline, a NUHS at home occupational therapist. Follow me as we head on the road to see our patients.
So usually we'll receive cases from the doctors, either from our own personal Teams chat, or we'll receive referrals via our Epic system. On the day that we receive, we will plan for the next day to actually review the patient for an initial assessment and also for treatment as well. Depending on the patient caseload, I might pack different equipments that they might use for their treatment today with me. Can be activities that they would find engaging, such as sensory engagement with plants, or it might be equipment that they might require, such as wrist brace for patients with hand conditions. So in terms of what we do with our patients, if we're doing an initial assessment, normally we'll check in with the family on how they are coping after the patient has returned home, if they've had any difficulties with managing their care at home as well, because every person's home environment is different and their needs also vary. So usually we will do a check-in with the family and also the patient on how they are managing at home currently. So usually we will explore on the home environment as well to check if there are any areas that we can make it a bit more safer for them, especially for elderlies who have been known to be admitted for falls. We might include recommendations for grab bars and other equipment around the house to make it such that they can perform their daily activities in a safer way. So the main differences with OTs being in the hospital and OT treatments at home is that at home we're actually able to properly assess their actual environment and actually how they are managing their activities in their home environment. Because in hospital, we'll usually look at discharge planning, so we might look into optimizing their function or changing a few of their habits. However, for patients who we may suspect cognitive impairment, for example, perhaps they have a whole different system in place at home to help them cope with their current activities, which we can actually see a bit more clearly when we come for the home visits.
That's all for today. Thank you for joining us on our journey today. And I hope you know a bit more about what we do as occupational therapists with NUHS at home.